You could easily make the argument that one of the most common causes of pain in adults, especially men, is tightness in the front of the hips, which definitely limits ability to do bridges. Which obviously involves a lot more than front of the hip mobility, also shoulders, thoracic, etc. But that's kind of the ultimate example. So, common problem, 1 of 5, at least, tightness in the front of the hip. So I'm going to show you 2 exercises. That's it. 2 exercises that can get you to that, and that's the end goal. You can still go further than that, but if you can get there, you know that tightness in the front of your hip, probably not an issue, something that's causing you pain. So the first exercise actually has a couple levels, and this is going to target your quads, so as hip flexors. Now this is where you start. This would be the beginner level, and I actually started here. I used to have crazy tightness in the front of my hips from years of playing hockey. This is the classic couch stretch. But important cues: bum tight, tuck your pelvis under. And you will progress that by moving the bench higher and higher until you get the bench near straight. So don't overlook those cues. This is how you can almost infinitely regress and progress every single exercise. People just fly through these different cues. If you are meticulous with these cues, which is what I'm showing you right now, you can leverage just 2 different exercises, the couch stretch and the one I'll show you afterwards, to get you to that bridge and get rid of tightness in the front of your hips. So that's the first level. That will then progress to, like I said, bench further up. And then we progress to on the floor. So even though technically the angle looks the same, there's just something about the angle that you're in on the floor that you will find, if you are meticulous with these cues, bum tight, tuck your pelvis under, and then sit back. It's a much deeper stretch. Now you can continue progressing this one yet again. You will go until you can get, I can't get there right now. I would have to spend maybe a 20-minute session, but I can get shoulders to touch this box here. And that is the standard for this one. Back and shoulders to the bench. And you'll find one side tighter than the other. So I was always a lot tighter on my left side. And then another progression to that, and this is actually a little bit different. Sorry for the background noise there, lots of construction today. This is called the FU hip stretch. I first saw this from Lucas Hardy at Range of Strength. Bit of a different focus. So you're actually gonna instead here push your hips down to the floor. So this helps a lot with that back bridge, in fact, because it helps you get into this hip extension. So once you've pushed hips to the floor, then you start to sit back. So it's a little bit of a different stimulus, same idea. So that's exercise, remember, that's just exercise number 1. You can spend several weeks, several months just on that one, chipping away every week, progressing up to open up the hips. The second exercise, you already know I'm big on this one, popularized by Ben Patrick, knees over toes, who's just brilliant, genius, is the split squat. And I'm going to show you how to perfect it, because it too can be progressed and regressed almost infinitely. So to start, we need to know the cues. And that is back knee as straight as possible, hamstring covering the calf, and then torso not forward, but nice and vertical. Now once you can do that, the progression is simple, at least in terms of how to apply it. It's just to go lower. So lower and lower, you'll find that stretch is greater and greater. and then eventually flat on the floor. So you'll notice big difference between these two exercises, which remember is really all you need: bent knee and straight knee. So we are training both different functions. So those are the two exercises. Remember those 3 cues on the split squats. Be meticulous with these. Back knee straight, bum tight, and torso vertical.